Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Recording in progress. Recording stopped.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Good afternoon, everyone. Welcome to the ninth and final iteration of the Unbottling the Truth, a webinar series with the topic of alcohol's role in liver disease. Our webinar for today is graced with three excellent speakers who will enlighten us with information on the harmful effects of alcohol consumption on the liver and beyond. So this is a CPD accredited webinar with two CPD units from the Council of Medicine and has applied for CPD units from the Council of Nursing. This webinar is brought to you by the Health Promotion Program, National Institutes of Health, University of the Philippines, Manila, Philippine Society of Public Health Physicians, Syntax Coalition, Philippine Cancer Society Incorporated, Yellow Warrior Society Philippines, and the Philippine Association of Patient Organizations. Before we start, we're reminding everyone that the views and opinions expressed in this webinar are those of the speakers and do not necessarily reflect the official stance of the Health Promotion Program, its affiliates, or its partners. And to maximize the limited time we have together, please take note of some of our house rules for this session. First, please message any of the organizers for assistance with technical concerns. For any questions directed to the panelists, you may type these in the Q&A function. If you have any trouble finding this, please let one of the organizers know. This webinar is being recorded and will be uploaded to our social media platforms. By staying in the room, you consent to having your likeness recorded. And finally, to receive your certificate for the session, it is required for you to register, attend via Zoom, and answer the evaluation form, which will be shown towards in the end of the webinar. To officially open our session, we have Dr. Isa Alejandria, Executive Director of the UP National Institutes of Health, to give the opening remarks. Dr. Alejandria, the floor is yours.
Okay. Thank you. So good afternoon and a warm welcome to our virtual audience. Okay. So to our distinguished resource speakers, Dr. Ian Homer Kua from St. Luke's Medical Center, BGC, Dr. Herdee Glorianne Luna and from Philippine Cancer Society, and Mr. Christopher Muñoz. To our partners, our valued partners from various health and advocacy organizations, and to all our guests here in the virtual floor, our nurses, doctors, healthcare professionals, government employees, civil society members, public health advocates. Thank you all for joining us today for this critical discussion on an important public health problem. I am honored to welcome you all to this webinar on Unbottling the Truth, Alcohol's Role in Liver Disease. Okay, so this webinar is actually being held in observance of World Hepatitis Day. And it serves as a powerful affirmation of our collective commitment to address, again, this significant public health challenge. So the harms of alcohol are varied and nuanced. It extends far beyond the liver to impact the health and well-being of individuals and communities as a whole. As the World Health Organization clearly states, there is actually no safe level of alcohol consumption. Alcohol is a primary driver of liver diseases, such as alcoholic hepatitis, cirrhosis, and liver cancer, placing a heavy burden on our healthcare systems and, most importantly, on the lives of our fellow citizens. So beyond causing liver disease, it's also a risk factor for malignancies, heart disease, and it can even lead to road deaths, road injuries, if abused. So today, we are not here simply to state the problem, but we are here to inspire a collective call to action to stop the abuse of alcohol. So through our speakers, our speakers will help us understand the process of alcohol-induced liver damage, explore the benefits of cutting, if not stopping, alcohol consumption, understand the lived experience of people with liver disease due to alcohol. So we also will hope to generate or design preventive strategies during the panel discussion that will focus on reducing alcohol consumption or even substance abuse in general. So, which is part of promoting health and well-being. So we would like to advocate for a healthy lifestyle, our practitioners to screen for risk factors, our healthcare providers. So we can see here that a holistic approach is actually imperative. So I am confident that by working together with our valued partners here and that through this webinar, we can make a meaningful impact in promoting liver health and eventually well-being, reducing alcohol-related harm, and our eventual goal and aspiration to have a healthy world. So again, thank you for spending your lunch listening to this webinar. Let's begin this important conversation. I'd like to congratulate the organizing team, the NIH Health Promotion Program led by Dr. Cathy Reyes and the team for this webinar series on alcohol. While this is the last, I believe this is the last of the series, which was launched last October. This is not the end, for the challenge that we need to address to promote, healthy lifestyle, to reduce, if not stop totally substance abuse in this webinar, particularly alcohol. Okay, so sit back, enjoy the webinar, and let's learn from each other. Thank you.
Thank you, Dr. Alejandria, for the warm message. Your message truly sets the bar for our discussion today. To get the ball rolling, I have the pleasure to introduce our first speaker for today, Dr. Ian Homer Y. Kua. Dr. Ian Homer Kua is a leading gastroenterologist and hepatologist, currently serving as Regent of the Philippine College of Physicians. He heads the Institute of Digestive and Liver Diseases at St. Luke's Medical Center, BGC, and is Chief of Hepatology at its Quezon City branch. He is the immediate past president of the Philippine Society of Gastroenterology and former president of the Hepatology Society of the Philippines in 2016 to 2017. Internationally, he served on the Executive Council of the Asian Pacific Association for the Study of the Liver and is a member of the World Gastroenterology Organization's Hepatology Interest Group. We will be watching a recorded presentation from Dr. Kua. Don't worry, he will be here later to join us during the Q&A session to answer your burning questions. Tech team, please play Dr. Kua's video.
Recording in progress.
Don't often take seriously alcohol and what it does to our liver. This isn't just for people who drink a lot. Magandang tanghali po sa inyong lahat. So thank you for being here today. I'd like to thank UP Manila National Institutes of Health Promotion Program for this kind invitation. We're going to talk about something many of us joke about but don't often take seriously, alcohol, and what it does to our liver. This isn't just for people who drink a lot. This is about our habits, our health, and the future of our communities. So let's begin by talking about what we want to achieve in this presentation. So we aim to understand how alcohol contributes to liver disease, especially hepatitis, cirrhosis, liver cancer, and we'll also discuss prevention because the earlier we act, the more lives we save. First, let's talk about how alcohol becomes a risk to the liver. Alcohol is deeply rooted in Filipino culture. Birthdays, fiestas, reunions, but over time, excessive drinking damages the liver, leading to long-term illness. And the impact is not just medical, it's also economic and social. Every year, 2.6 million people die globally due to alcohol. During the first year of the pandemic, alcohol-related deaths jumped by 25% worldwide, and ALD accounts for 60% of alcohol-related deaths, a huge burden we often overlook. But what counts as too much? So let's clarify how we measure alcohol intake. A standard drink isn't what you think. So one bottle of beer, one shot of gin, or one glass of wine, they all carry the same weight when it comes to the impact to the liver. So what's considered unhealthy or risky drinking? So binge drinking is having more than 4 drinks for women or 5 for men in one sitting. On the other hand, heavy drinking is more than 8 per week for women or 12 for men. And these numbers matter because they reflect the risks of liver injury, not just behavior. So the risk also depends on the body type. So let's adjust for that. If your BMI is below 30, even 2 to 3 drinks per day may already be harmful. For those with higher BMI, even fewer drinks can still be dangerous. So we often think we can handle our alcohol, but the liver doesn't negotiate. So in a nice study from Korea, they look at patients with fatty liver with no baseline liver disease. The key finding, even in low alcohol intake, in increased risk of advanced liver disease as well as liver cancer. The lowest risk at 0 standard drinks per day, the risk rises with every additional drinks. So in fatty liver, abstinence is safest and there's no safe threshold for alcohol. In 2023, 5% of Filipino adults were affected by alcohol-related liver disease, higher than the global average. Most were men in their late 40s, around 30% progress to cirrhosis, and 10 to 15% also have hepatitis B, which worsens the liver outcomes. And the drinking patterns among Filipino explain why this is happening. 40% of Filipino drank alcohol in the last 30 days, a third engaged in heavy or high-risk drinking, and on average, we consume 6.4 liters of pure alcohol per person per year, way above the Southeast Asian neighbors. And this problem is starting even earlier in high school. So in one survey, 5% of Filipino students aged 13 to 17 drank alcohol recently and 9% have been drunk. So with no legal drinking age and aggressive alcohol marketing, our youth are highly exposed. Many buy alcohol from informal retailers, no ID required. So aside from health, let's look at the broader impact of alcohol use on our society. Alcohol costs around 1.15 trillion annually, nearly 5% of the GDP. So that includes healthcare, road accidents, violence, and low productivity. Yet only 1 in 5 Filipinos with alcohol use disorder actually seeks help. So let's understand the different factors that influence how the liver disease progresses. So apart from alcohol, other risk factors include obesity, sex, genetics, hepatitis infection, and even diet. So this means we need a holistic view, not just blaming alcohol, but managing all the risk factors. So what actually happens inside the liver? So when the liver breaks down alcohol, it produces acetaldehyde, a toxic compound that causes inflammation and scarring. Over time, this leads to fibrosis and eventually cirrhosis. How do we know if someone already has alcohol liver disease? So diagnosing alcohol liver disease is often a clinical challenge. There's no single test we can rely on. So most patients are asymptomatic at first, rely on history, laboratory markers like AST-ALT ratios and imaging, and sometimes liver biopsy confirms the diagnosis. And alcohol makes existing liver conditions worse. Alcohol accelerates the damage from fatty liver disease, which is already common in people with metabolic syndrome, diabetes, obesity. So that's why screening is essential, especially in the primary care. So let's begin with screening. So one of the most practical and validated tools we can use in any clinical setting is the Audit C, a brief three-question tool that identifies individuals who drink at risky levels. It asks about the frequency of drinking, quantity per drinking occasion, and how often they binge, like more than six drinks per session. So in the Philippines, where many patients may be reluctant to volunteer information about alcohol, the Audit C is helpful because it's structured, quick, and less confrontational. In the primary care setting or barangay health centers, even asking these three questions can open the door to early intervention. And once we screen, we need to assess for liver involvement even before symptoms begin. So to diagnose alcohol use disorder, we use DSM-5 criteria. So if a patient meets two or more out of the 11 criteria within 12-month period, like drinking more than intended, failing to cut down, or continued use despite harm, they may have alcohol use disorder. So severity depends on how many criteria are met. 2 to 3 is mild, 4 to 5 is moderate, 6 or more is severe. So this structured approach helps us identify those who need help, even if they don't think they have a problem yet. So now we know how we diagnose AUD using DSM-5, but there's a catch. So this relies heavily on what the patient tells us. Accurately assessing alcohol use is challenging, especially in the Philippines. Many patients underreport their intake, often unintentionally. Why? One, because of cultural stigma. Drinking is normalized in celebrations but frowned upon in the clinics. Second is a fear of judgment. Patient fear being labeled alcoholic. Third is poor recall or social desirability bias. So they'll tell us what they think we want to hear. And lastly, denial. So they may not see their drinking as a problem. So even with tools like the Audit C, the self-reported data can be misleading, especially in early stages of liver disease when patients feel well. So how do we move forward with a diagnosis when we can't fully rely on what patients tell us? So this is where a structured, evidence-based, algorithmic approach helps. So step one is the history of significant alcohol use with the utility of Audit C and the audit tools. The second step is to exclude other causes such as fatty liver, hepatitis B or C. Third is to use lab markers and imaging to assess liver injury. Lastly is to confirm advanced disease through non-invasive tests. So this approach prevents both overdiagnosis and underdiagnosis, critical in settings with limited access to specialists. And when patients are not forthcoming, biomarkers can give us objective answers. So biomarkers are tools that would measure our recent alcohol consumption objectively, so there's no need to rely on self-reporting. So the most reliable is the phosphatidyl ethanol or PET. So it detects alcohol use in the past 2 to 3 weeks. It's not affected by liver disease, making it more accurate than the breath analyzers or the liver enzymes. Other biomarkers include the CTD, the ETG-ETS in the urine. While the PET isn't widely available in the Philippines yet, Knowing about these tests helps us advocate for their future inclusions in our national guidelines. So now that we can objectively detect alcohol use, let's talk about how to measure liver damage. So we now have multiple non-invasive tools to estimate fibrosis in alcoholic liver disease. First, we have the FIV4. It's rather simple, uses age, AST, ALT platelets, great for clinics and district hospitals. Second, we have the ELF or the Enhanced Liver Fibrosis Test. It measures the extracellular matrix turnover, highly predictive of progression. It's not available in the Philippines. Lastly, it's a fibro test. Combining the blood markers with algorithm requires the software. So among this, FIV4 is most accessible in the Philippine settings and should be used routinely in evaluating patients with suspected alcoholic liver disease. And to complement this, we now have a highly useful imaging tool, the VCTE or the FibroScan. The VCTE, better known as FibroScan, uses ultrasound technology to measure liver stiffness, tells us fibrosis stage. The CAPS score detects a fatty liver, and the machine gives us a number. If less than 7 kPa, meaning there's no or mild fibrosis, 8 to 14 kPa significant to advanced fibrosis, and more than 14 kPa suggestive of cirrhosis. So in the Philippines, FibroScan is now available in some tertiary hospitals as well as the laboratories. And we should refer moderate to high risk patients, especially those with rising FIV4 scores or abnormal ALT. Non-invasive tests like the FIV4, the ALF, the fibro test, and the FibroScan are essential in assessing severity of alcoholic liver disease. So there's no need for a liver biopsy in most cases, and liver stiffness measurement via FibroScan correlates with fibrosis stage, predicts the risk of decompensation and mortality, and can be used to monitor disease progression over time. So these tools help us act early and appropriately even before symptoms appear. So when do we actually need a liver biopsy? So in most cases, liver biopsy is not required for ALD diagnosis. We reserve it for cases like diagnostic uncertainty, suspected overlapping liver disease such as autoimmune hepatitis, fatty liver and alcohol, and transplant evaluation. If fibrosis is confirmed, whether by biopsy or non-invasive tests, then we act early. So first, we counsel the patient. We have to educate them on the risk of progression to cirrhosis or liver cancer. Refer to a liver specialist if available, and start nutritional support and AUD treatment immediately. So these steps can halt progression, even reverse some damage if done early. And that leads us to our next point. So abstinence is a cornerstone of treatment in patients with ALDs. Without it, nothing else works. In severe cases like alcoholic hepatitis, we may need pharmacologic therapy or even consider liver transplant. And let's not forget nutrition is just as critical. Many of our patients are malnourished even before they walk into our clinic. So this is often underappreciated but has a major impact on outcomes, especially in severe disease. Malnutrition is common in ALD, seen in up to 70 to 100% of severe cases. So we use the subjective global assessment to check nutrition status quickly and target 35 kcal per kilogram per day, 1.2 to 1.5 grams per kilogram per day protein. And we have to avoid unnecessary protein restrictions because muscle loss worsens outcomes. So if intake is low, we can start oral or enteral feeding, and also always supplement thiamine, B12, and zinc, especially in those with alcoholic hepatitis. Malnutrition is treatable, and doing so significantly improves outcome. So let's move to liver cancer screening and long-term surveillance next. So liver cancer risk increases with patients with cirrhosis. So regular ultrasound every 6 months helps detect cancer early, especially combined with AFP levels. And for alcoholic hepatitis, how do we assess and treat it? So alcohol hepatitis is a severe inflammatory liver injury caused by recent heavy drinking. According to the NIAAA criteria, includes symptoms appear within 60 days of heavy alcohol use, AST more than ALT, but both less than 400, total bilis more than 3, and of course, there should be no other causes of liver disease. And this helps us distinguish alcohol hepatitis from other liver conditions. So to guide treatment and prognosis, we use scoring tools such as the Madrace discriminant function. If the DF is more than 32, indicates severe alcohol hepatitis, we consider steroids. MELD score helps predict 90-day mortality, and the LIL score tells us if the patient is responding to treatment, usually check after 7 days. And these scores help us decide who to treat, how long, and when to stop. So here's a simple pathway for the treatment of alcohol hepatitis. We have to confirm the diagnosis of alcohol hepatitis using clinical and laboratory criteria. Second, rule out infection and GI bleeding. Third, assess severity with MADRE and MELD. If severe and no contraindication, we can consider prednisolone. Reassess at day 7 using LIL score. If no response, stop steroids. Consider other options such as liver transplant or palliative care. Supportive care, including nutrition, is essential throughout the course of treatment. The only proven medicine for severe alcohol hepatitis is prednisolone, 40 milligrams daily for 28 days, but this works best when combined with alcohol cessation and nutritional support. There's no magic drug. Outcomes still rely on overall supportive care. Lastly, let's not forget the root cause. Alcohol use disorder is a medical condition, not just a bad habit. It's defined by an impaired ability to stop or control alcohol use even when causes problems in health, work, or relationships. And unless we treat the AUD, the liver disease will keep coming back. So to catch alcohol problems early, as I discussed before, we should screen every adult patient, especially in the primary care or during the hospital admissions. The recommended tool is the Audit C, just 3 questions, quick, easy, and more accurate than asking, do you drink? It helps us flag patients with unhealthy alcohol use, including those at risk for AUD and even before liver damage occurs. Treating AUD needs a multidisciplinary approach. Second, brief motivational interventions, even just 5 minutes, can help start behavioral change, addressing coexisting mental health conditions, and our goal is abstinence. That's the only way to halt or reverse liver disease progression. With proper treatment, we can reduce costs, hospitalization, even improve survival, even in advanced ALD. So let's now look at how behavioral therapies and personal feedback can support long-term recovery. So treating AUD should start early and be continuous, no matter the stage of liver disease. Even a brief 5-minute talk can help. Behavioral therapies like CBT, motivational interviewing, 12-step support, and couples or community therapy all play a role. Every clinic visit is a chance to help someone reduce or quit drinking. So one proven approach is personalized feedback. So if the patient see their liver scan or fibrosis result, say through FibroScan, it becomes real for them. So pairing that with a brief talk from a doctor can cut drinking by 36%, even high-risk groups. Simple but effective method. So treating alcohol liver disease effectively starts with addressing alcohol use, whether it's mild liver damage or full-blown cirrhosis. Without treating the AUD, medical therapies won't go far. So we now have FDA-approved medications like naltrexone and acamprosate. Some off-label options like baclofen may also help, especially for patients with liver disease. But remember, medications work best when paired with counseling. So technology is changing the game. Nowadays, AI and mobile apps now support early detection, risk prediction, even real-time feedback, making help more accessible for those with AUD or ALD. So one study found that smartphone sensors tracking movement, voice, even sleep may help detect alcohol cravings and mood changes before relapse happens. So imagine predicting relapse before it occurs. It could be our next breakthrough. So what steps can we take? So this is the new paradigm in managing alcohol-related harm. Start with routine screening, provide brief, clear advice, use motivational interviewing, consider medications for alcohol use disorder, and most importantly, refer to the addiction specialist, psychiatrists, or community support groups when needed. So we do have some policies in place. This is for the alcohol regulation in the Philippines. So it tackles drunk driving, raise alcohol taxes for health funding, regulates the ads, but many youth-oriented ads still slip.
Good afternoon, everyone. We're just experiencing a slight technical difficulty. The team is working on it, so please stay on the call lang. Thank you. So while waiting, I would like to emphasize that this webinar is again brought to you by the Health Promotion Program, National Institutes of Health, University of the Philippines, Manila, Philippine Society of Public Health Physicians, Syntax Coalition, Philippine Cancer Society Incorporated, Yellow Warrior Society Philippines, and the Philippine Association of Patient Organizations. This is a CPD accredited webinar with 2 CPD units from the Council of Medicine and has applied for CPD units from the Council of Nursing. In case that you have any questions, you may type this later in the Q&A function. And if you have trouble finding this, please let one of our organizers know.
This is about our habits, our health, and counseling. So technology is changing the game, liver damage, risk groups, simple but effective method. So treating alcohol liver disease effectively starts with addressing alcohol use, whether it's mild liver damage or full-blown cirrhosis. Without treating the AUD, medical therapies won't go far. So we now have FDA-approved medications like naltrexone and acamprosate. Some off-label options like baclofen may also help, especially for patients with liver disease. But remember, medications work best when paired with counseling. So technology is changing the game. Nowadays, AI and mobile apps now support early detection, risk prediction, even real-time feedback, making help more accessible for those with AUD or ALD. So one study found that smartphone sensors tracking movement, voice, even sleep may help detect alcohol cravings and mood changes before relapse happens. So imagine predicting relapse before it occurs. It could be our next breakthrough. So what steps can we take? So this is the new paradigm in managing alcohol-related harm. Start with routine screening, provide brief, clear advice, use motivational interviewing, consider medications for alcohol use disorder, and most importantly, refer to the addiction specialist, psychiatrists, or community support groups when needed. So we do have some policies in place. This is for the alcohol regulation in the Philippines. So it tackles drunk driving, raise alcohol taxes for health funding, regulates the ads, but many youth-oriented ads still slip through, and propose to raise the drinking age to 21, though it needs refinement to avoid discrimination. So recently, tax stamps were introduced last year that curb illegal alcohol by 10%. This year, DOH began piloting AUD screening. 12% screened positive, but only one out of the five sought help. What are the biggest challenges in the Philippines? Cultural acceptance, there's also stigma, very weak ad regulation, and limited access to affordable treatment. So here's what we need to push for: stronger rules on alcohol marketing and online sales, make treatment more affordable and stigma-free, improve HB 7053 so it protects vulnerable groups, and add mandate clear health warnings on alcohol packaging. So alcohol is a leading but preventable cause of liver disease in the Philippines. It drives inflammation, fibrosis, and cancer, and often silently until it's too late. Progression is not inevitable. So with screening, we can catch liver disease early. With education and policy, we can reduce harmful drinking. With access to treatment, we can help people recover and thrive. So let's act together as clinicians, communities, and policymakers to break the stigma, expand care, and change the future of liver health in the Philippines. So I'd like to thank Dr. Nikki Payawal of MD Visual Studio for my slides. Maraming salamat po.
Thank you, Dr. Kua, for sharing the science behind liver disease, how alcohol contributes to the risk of its development, and the available treatments for it. We know that alcohol consumption is a primary driver of liver diseases, such as alcoholic hepatitis, cirrhosis, and liver cancer. However, with Dr. Kua's discussion, he provided us with a baseline on how alcohol consumption a baseline on alcohol consumption and how much is too much. He also emphasized how treatment should take on an holistic approach and not just focus on a particular aspect. So again, once again, thank you, Dr. Kua. Up next, we have our second speaker, Dr. Herdee Glorianne C. Luna. Dr. Herdee Glorianne C. Luna is a graduate of the University of Santo Tomas, Faculty of Medicine and Surgery. She completed her internal medicine residency and medical oncology fellowship training at the National Kidney and Transplant Institute. She's the current research head at the NKTI section of medical oncology and executive action and her role as the Oncology Manager at the Philippine Cancer Society. She's the immediate past president of the Philippine Society of Oncologists. She's also a member of the Philippine College of Physicians, European Society for Medical Oncology, and the American Society of Clinical Oncology. She is affiliated with the Lung Center of the Philippines and St. Luke's Medical Center in Quezon City. Without further ado, Dr. Luna, the floor is yours. To our audience, we're just waiting for Doctor for our next speaker. She's in the call already. Dr. Luna, can you hear us po?
Oh, there you go. Okay, I've been trying to unmute myself. All right, good afternoon, everyone. I'm Dr. Herdee Glorianne here. We explore the most prevent in our time. It's alcohol in the liver damage, and I'm here to discuss to walk you through regarding the global burden of alcohol-induced liver disease, examine underlying mechanisms. These has been discussed also by Dr. Fu a while ago. Discuss some treatment approaches. More importantly, outline the public health strategies that can prevent this large avoidable condition. Our goal is to understand not just the clinical aspects, but also the broader societal implications and interventions needed to address this epidemic. Next slide, please. There. So alcohol is a major contributor to mortality and disability worldwide. It affects broad range of health outcomes from injuries to cancers and infectious diseases. Alcohol is a psychoactive, toxic, and dependence-producing substance that is causing to over 200 health conditions. Health risks beyond cancer includes alcohol dependency syndrome, liver disease, hypertensive heart disease, hemorrhagic stroke, pancreatitis, traffic and violence-related injury, including women or violence against women and girls and children, and of course, suicide, among others. It accounts for about 5% of the global disease burden across all income levels, leading risk factor for premature death in ages 15 to 49 years of age, causing 10% of deaths in the group. There's also disproportionate impact on this population due to compounding risks and inequalities. Next slide. Any level of alcohol consumption is usually associated with detrimental impact, especially on population health, and is significantly important public issue. Factors that influence drinking patterns can include personal characteristics such as genetics, demographics, and socioeconomic status, drinking behaviors, availability and affordability of alcohol, or alcohol policies and taste. These health risks are indicative of the risks alcohol also poses to society, particularly related to intentional or unintentional harm, crime, and violence. The harm use of alcohol results in death of 2.6 million people annually. The links between alcohol and economic harms can range from damage to property and negatively impacting family budgets to broader social impacts such as high costs to healthcare budgets, and particularly for adolescents, lower performance at school, being less likely to complete higher education, and therefore is cumulatively negatively affecting economic growth, social welfare, and worsening inequities. Next slide. Putting this in our local context, alcohol caused more than 24,500 deaths in the Philippines in 2021. Alcohol is up from 14th place in 1990, so the contribution of alcohol to health harm is growing in the Philippines. Since 1990, DALYs per 100,000 people due to alcohol have increased by 9.5% in the Philippines. Among 15 to 49 years old, alcohol is the third biggest risk factor for disease burden in the Philippines. There has been also a dramatic increase in cardiovascular disease due to alcohol, and alcohol deaths have increased by 25% since 1990. The global burden of disease shows that NCDs due to alcohol have increased dramatically. There has been 45% increase since 1990. Measured in DALYs per 100,000 people, cardiovascular disease due to alcohol has increased 238% since 1990. Cancer due to alcohol is increasing. Philippines faces a dramatic increase in cancer caused by alcohol. In 2021, cancer due to alcohol caused at least 3,500 deaths in the Philippines. Since 1990, there is a 58 increase in the number of DALYs per 100,000 people due to cancer caused by in our country. The contribution of alcohol to health harm is growing in the Philippines. Next slide, please. The link between alcohol and cancer is not a new discovery. The International Agency for Research on Cancer has identified alcohol as group 1 carcinogen, meaning there is convincing evidence that it causes cancer. World Cancer Research Fund and AICR, there is convincing evidence that alcohol increases the risk for cancers of the mouth, larynx, esophagus, liver, colorectal, and postmenopausal breast cancer. Next slide. Looking at the global picture, 741,300 cancer cases worldwide in 2020 were attributable to alcohol. This chart breaks down these cases by the amount of alcohol consumed per day. While the risk of cancer is lower at lower levels of consumption, demonstrated by 185,100 cancer cases among those who drink 2 drinks or less than 2 drinks per day, a significant number of people consume a small amount of alcohol daily. This pie also demonstrates a similar number of cases, 153,400 cancer cases, a similar number of total cases as those who drink more heavily, as demonstrated here, at 6 or more drinks per day. That's more than 90 grams of alcohol. Simply put, we should think about drinking moderately messaging. This highlights that there is no safe level of alcohol consumption when it comes to cancer. Next slide. Alcohol consumption is a major risk factor for multiple cancers, and the risk of developing cancer increases substantially with the amount of alcohol consumed. No safe level of consumption when it comes to cancer. So alcohol increases the risk of mouth, pharyngeal, laryngeal cancer, esophageal squamous cell carcinoma, liver cancer having more than or equal to 45 grams ethanol per day, colorectal cancer having more than or equal 30 grams ethanol per day, and breast cancer, whether pre and postmenopausal, there is no safe threshold. Next slide. The risk increases with the amount consumed, highlighting dose-dependent effects. For some cancers like breast and oral cavity, even low levels elevate the risk. For others, higher threshold define significant risk. You see here dose response highlights. Oral cavity cancer, there's 15 increased risk per 10 grams ethanol per day. Esophageal squamous cell carcinoma, there's 25% increased risk per 10 gram ethanol per day. Liver cancer, increased risk about 45 grams per day, and colorectal cancer, increased risk starts around 30 grams per day. And to highlight again, in breast cancer, risk rises with any intake. The illustration here also demonstrates that about 5 more women out of 100 women would develop cancer due to consumption of 2 drinks a day or 14 drinks per week. And about 3 more men out of 100 would develop cancer due to consumption of 2 drinks a day or 14 drinks a week. Next slide, please. The mechanism of alcohol-related cardiogenesis, as you can see here in the upper left, mechanism A, alcohol main metabolite acetaldehyde is carcinogenic, causing DNA damage, impaired repair, and this is the pathway of acetaldehyde toxicity and genotoxic effects. Mechanism B includes oxidative stress and inflammation, propagate carcinogenesis across multiple sites. All lead to impaired DNA repair mechanisms. Alcohol alters the level of multiple hormones, including estrogen, which can increase breast cancer risk, as shown in mechanism C. And lastly, alcohol as a solvent and enhancer enhances the carcinogen absorption and penetration, as demonstrated in mechanism D. Furthermore, alcohol metabolism generates carcinogenic byproducts like CYP2E1 induction and chronic inflammation and dysbiosis in the liver and the gut. These mechanisms are consistent across various cancers linked to alcohol. And next slide, please. The evidence was consistent, and dose response meta-analysis showed a significant increased risk with increasing alcohol consumption. Alcohol consumption of 40 to 45 grams per day increased the risk of liver cancer. Next slide, please. Who should be particularly concerned about liver cancer? Aside from heavy alcohol use, your risk is also high if you have other liver conditions, as mentioned by Dr. Kuo, like metabolic liver disease, which is linked to being overweight or diabetic. Other risk factors include viral B hepatitis or hepatitis C and inherited liver disease. Next slide, please. Early detection is key, but liver cancer often doesn't have symptoms in its early stages. When symptoms do appear, they can include less appetite, bloating, unexplained weight loss, yellowing of the skin and eyes, and upper right abdominal pain. Next slide. If you have a high risk of developing liver cancer, it's very crucial to get regular screening tests. This is how we can find cancer early when treatment options are more effective. Next slide. Screening for liver cancer typically involves two main tests, ultrasound of liver and biomarker testing. These tests help doctors look for signs of cancer and can be used to monitor high-risk individuals. Next slide. Depending on the initial screening results, your doctor may recommend additional imaging testing, such as CT scan, MRI. You may also need more blood tests and other tests to help your healthcare team plan for the best course of treatment for you. Next slide. The definitive way to diagnose liver cancer occasionally is through a liver biopsy, but there are non-invasive options as well. Your doctor will take small sample of your tissue from your liver to examine it for cancer. This is a step in confirming the diagnosis and determining the best treatment plan. Next slide. Treating liver cancer often requires a team of specialists. These may include hepatologists who specializes in liver, oncologists for cancer treatment, surgeon, an interventional radiologist, a radiation oncologist, and a liver transplant team. Next slide. Unfortunately, again, early liver cancer is often asymptomatic, which leads to diagnosis at advanced stages in the Philippines. This significantly limits curative options and diminishes the patient's prognosis. Patients with advanced disease endure severe symptoms, intractable pain, ascites, and jaundice. The prognosis is grim with a 5-year survival rate typically below 20%. This is why early detection and prevention are so critical. Next slide. Building systematic approaches to early detection requires a comprehensive coordinated efforts across multiple health care levels. Population-based screening programs, we must move beyond opportunistic screening to systemic population-based approaches. Universal screening for adults over 40 years with any significant alcohol history creates a safety net that catches cases before they become asymptomatic. Risk stratified approaches allows us to intensify screening for high-risk groups while maintaining cost effectiveness integration with existing programs such as cancer screening initiatives, routine health checkups, and preventive care visits. These all maximize efficiency and patient compliance. Quality assurance is crucial. We need to standardize protocol, training programs for healthcare providers, and continuous monitoring of screening effectiveness. Without quality assurance, screening programs can provide false reassurance while missing critical cases. Health provider education training. Many healthcare providers lack confidence in recognizing alcohol-related liver disease risk factors. We need comprehensive training programs that help providers identify subtle physical signs, understand when to screen, and interpret screening results. Screening technique and training is very essential. Not every provider needs an expert ultrasonographer, but they should understand basic liver palpation, recognize concerning physical signs, and know how to use screening tools effectively. Equally important is education about referral pathways. Providers need to know when to refer, where to refer, and how to communicate with patients about referrals. Clear guidelines and communication protocols prevent patients from falling into the cracks in the system. Community outreach and mobile screening. Health equity demands that we reach underserved populations. Mobile screening units can serve rural and remote communities where access to specialized care is limited. These units can provide basic screening and facilitating referral to appropriate care. Community health workers trained in basic screening techniques can extend or reach into communities where traditional healthcare access is very limited. They can identify high-risk individuals and facilitate connections to comprehensive care. Workplace screening programs can target high-risk occupations and industries. Some occupations have higher rates of alcohol consumption, and workplace programs can provide convenient access to screening services. The goal is creating comprehensive screening ecosystem where no one needs to who needs screening falls through the cracks. Next slide. The economic burden of alcohol harm in the Philippines has reached alarming levels. According to research from Action for Economic Reforms, harm due to alcohol and tobacco costs the country 1.1 trillion annually. This financial strain impacts healthcare productivity and overall societal well-being. Alcohol harms extend far beyond the purchase price of these products. According to the AER report, with indirect costs, including lost productivity due to illness and premature death, the indirect cost reached 703.5 billion pesos in 2021. When combined with direct healthcare expenses, the estimated economic burden soared to 1.055 trillion pesos. This exceeds the 2025 budget of the Department of Education and the Department of Health. The new figures matter greatly for an evidence-based understanding of alcohol harm and cost to the society in the Philippines. In 2029, Movendi International reported about a study by the Filipino government that showed costs due to alcohol harm amounted to 200 billion pesos annually. This study was conducted by the House of Representatives, Ways and Means Committee, and the Department of Finance. New figures are more precise and comprehensive and show how much the government underestimated alcohol harm and cost in the Philippines in recent years. Next slide. 39,802 Filipinos died from alcohol-related causes in 2019. In addition, in 2021 survey by the DOH found that 40% of Filipino adults reported alcohol use, increasing from 38% in 2019. Among them, 33% engaged in heavy alcohol sessions, leading to further health risks. The products and practices of alcohol industry fuel serious burden of premature deaths and disease in the Philippines. The Global Burden of Disease report warns that alcohol and tobacco use together cause 115 deaths annually in the Philippines. Moreover, these substances lead to 3.9 million yearly health life loss, severely affecting families and communities. Next slide. So preventing alcohol liver requires cohesive strategy, integrates public health initiatives, community engagement, and policy involvement. Next slide. Focus more on behavioral change aspects, which plays a pivotal role in reducing liver cancer risk, promoting healthy behaviors, and reducing alcohol consumption requires a multifaceted approach: education, counseling, brief interventions, risk assessment, and policy enforcement. Next slide. SAFER is a WHO initiative to help countries implement proven strategies to reduce alcohol harm. Beyond health ministries, SAFER requires partnership across government sectors and safeguards policy making from context of interest. Next slide. 5 areas of intervention reduce alcohol harm: strengthen restrictions on alcohol availability, advance and enforce drinking driving countermeasures, facilitate access to screening, brief interventions and treatment, and enforce bans or restrictions on alcohol advertising, sponsorships, and promotion, and raise prices on alcohol through excise taxes and other pricing policies. The SAFER package concentrates on these 5 key strategies. Next slide. Limiting where and when alcohol can be sold reduces harmful drinking. Effective licensing and enforcement ensures compliance, while consideration of new sales channel like online platform is very critical. Next slide. Drink driving is major cause of injury and death. Establishing a strict blood alcohol concentration limit and ensuring enforcement through checkpoints and penalties combined with public awareness efforts can save lives. Next slide. Health systems play a pivotal role in identifying individuals at risk and providing early advice or treatment. Training and integrating services enhances effectiveness and accessibility. Next slide. Alcohol marketing significantly influences young people's drinking behavior. Strong, comprehensive regulations are necessary to prevent the industry from promoting alcohol to minors. Next slide. Increasing alcohol prices reduces consumption and related harm. Pricing policies must be well designed and enforced to avoid unintended consequences like illicit sales. Next slide. Success depends on sustained implementation, close monitoring, and safeguarding policies from vested interests, ensuring that public health remains a priority. Next slide. Alcohol-related harm can be dramatically reduced with the safer strategies. It will take coordinated effort, political commitment, and focus on protecting health to achieve safer work. Next slide. The data is clear. Alcohol harm places a tremendous financial and health burden on the Philippines. By implementing more comprehensive and evidence-based alcohol policies, especially raising alcohol taxes, the country has the opportunity to take decisive steps towards healthier, more sustainable, and resilient society. In addition, mandatory health warning labels on alcohol products and restriction from banning promotions and sponsorship products should be properly implemented to support reducing alcohol consumption at population level, as well as increase public awareness of the links between alcohol and cancer. 1 in 3 Filipinos report binge alcohol use in the past months. And there's 200 billion pesos annual cost of alcohol harm. The consequences of alcohol harm extend beyond those who consume it. For instance, alcohol fuels road traffic crashes, domestic violence, and other secondhand harms of severely affecting children. Another dimension is workplace absenteeism and presenteeism due to alcohol that harms workplace safety, cohesion, and productivity. In 2021, survey data from the Philippine government reveals the severity of alcohol burden in the country. The government responded with a landmark action, increasing taxes on alcohol and tobacco in order to invest their revenues into achieving health for all and universal health coverage. Next slide. So there is no safe level of alcohol drinking consumption for cancer risk. Consuming light or moderate amounts of alcohol is not safe as there is no threshold at which cancer risk of alcohol suddenly begins or below which the risk of at least some cancer does not increase. The notion that alcohol may protect against some cardiovascular diseases or type 2 diabetes is superseded by the clear dose response risk it poses. The more you drink, the higher your risk of cancer. Conversely, the less you drink, the lower your cancer risk. Therefore, despite the uncertainties about the effects of moderate alcohol consumption on non-cancer outcomes, drinking alcohol is not recommended for any health benefit. The risk of cancer and potential other health conditions far outweighs any potential existence of protective effects. It is crucial that everyone is better informed about the serious effects, health risks, including cancer risk and associated with alcohol consumption. So what is our goal? For cancer prevention, the best choice is not to drink at all. But if you do choose to drink, you should stay within your national guidelines for alcohol consumption. And remember, these limits are not zero risk. Next slide. What can we do in our own individual ways? We need to shift the culture together. Now, avoiding alcohol for cancer prevention is not just about individual choice. It's about shifting our mindset, our culture. So let's talk about 3 ways how to do that. First, we normalize no. We need to make not drinking a visible and acceptable choice. If people hear someone say no thanks without a long explanation, it becomes normal. It stops being awkward or unusual. Second, we get curious, non-confrontational. If someone says they don't drink, it's not a rejection of you or your company. It's simply their choice. Instead of taking it personally, let's offer understanding and support. And third, we name the stakes. This is not just about avoiding awkwardness in social settings. It's about health. Alcohol is linked not only to cancer, but also to over 200 other health conditions. People deserve to have the facts. They should feel supported, not pressured, when they choose to act on that information. Next slide. So I'd like to end with a powerful message. No Filipino should die from a preventable cancer. This is the time to act now. Alcohol-related liver cancer is largely preventable if we take action together. Integrated public health efforts can make a huge difference. Again, this means investing in early detection programs, engaging communities, supporting healthy behavior change, and putting in place strong evidence-based policies. By doing this, we can save lives and reduce the burden in our healthcare system. But we cannot do it alone. We need a united multi-sectorial effort, government agencies, healthcare providers, NGOs, communities, and individuals all working together. If we act now, we can make cancer prevention and treatment more accessible and more effective for every Filipino. Thank you very much.
Thank you po, Dr. Luna. Your discussion po on the epidemiology of liver cancer, supported by data-driven evidence that highlights the social demographic of those at risk, provides us a comprehensive framework in creating and promoting policies and programs that centers on how preventive measures, treatment, and post-treatment can be integrated into our current health system and ultimately reduce the prevalence of alcohol-related diseases among Filipinos. And just like you said, Doc, ultimately the goal is to save lives and reduce health care costs. So again, once again, thank you po, Dr. Luna. To cap off the stimulating discussion on the present topic, let me introduce our last speaker for today, Mr. Christopher Muñoz. So Sir Christopher Muñoz has been a health advocate since 2010, together with the Yellow Warrior Society Philippines. He became the Vice President of the Philippine Alliance of Patient Organizations in 2019, where he focused on policymaking to improve the Philippines' health system. Currently, he represents civil society in the Health Technology Assessment Council. It is truly an honor to hear the insights from Mr. Muñoz. Take it away, sir.
Hello, good afternoon. So thank you to the organizers for inviting me here to speak. So I'll just introduce PAPO. So the Philippine Alliance of Patient Organization is an umbrella organization of 52 disease-specific groups. It is a unifying body with one voice that supports and strengthens patient organization. And its mission is to serve a strong and active network of patient groups that will empower Filipino patients to advocate for their rights and become productive members of society. The other organization that I head is the Yellow Warrior Society Philippines, in which I am currently an advisor. So it is a group with people living in viral hepatitis. So we are more focused on expanding treatment and care, screening, treatment and care, and of course, the discrimination issue that exists for those who have hepatitis B. Next slide, please. So the cause of alcohol is not only to the drinker itself. It affects other people that is close to them also. Next slide, please. So what happens to the people close to those who drink? Diba? Siyempre, we often say that it is those who drink has the right to choose whether to drink or not. But sometimes it causes pain on their family members and strain on their relationships, leading to conflict, domestic violence, separation, or divorce. So in one case, we had a friend that doesn't come with us when we go out. No, and we just recently knew that he's a battered wife. So parang pag tuwing may lumalabas at nagsiselos yung husband niya. So the husband goes home, then drinks. Then after that, nabubugbog na yung wife. So yung mga ganun, diba? It's very, parang sabi ko, why did you marry him? Sabi niya, tahimik naman daw yun pag, when he doesn't drink. But when he drinks, that's a problem. And then, of course, it also affects their children's emotional well-being and development. So when that happens, the children went to their rooms and hide to avoid further confrontation. And of course, it also had effect on community burden. It increases crime rates, violence, and drunk driving incidents. Di ba? Usually pag nagiinuman na isang group, mamaya-maya makita mo nagbabatuhan na, di ba? Even friends after drinking, nag-aaway na. So, is it worth it to drink? Di ba? Kasi you don't drink with one bottle, bihira naman yun. Usually you drink continuously until you drop. So it also places pressure on healthcare, law enforcement, and social services. And of course, there's also workplace issues, di ba? When someone gets drunk overnight, tomorrow it's either absent yung tao or pumasok, then their productivity is being very low, then accidents may happen. And of course, conflict with workers usually happens also. And economic strain, of course, when you're always like that, you get to be fired from your job. So there's financial instability, increase in poverty, especially in low income household. So it contributes to the national economic loss through healthcare costs and labor costs. And these costs affect individuals, families, business, and government, placing a heavy financial strain on the economy. Next slide, please. So for the person who drinks, of course, what will happen to him? He can have mental disorders or liver disease. Diba? To have cirrhosis, getting liver cancer. And of course, stigmatization or social isolation when you're often used to drink. So syempre darating na the time that you will be marginalized and excluded from the community. And of course, it affects in children. Diba? When they grow up, they have a family with that kind of abusive father, the father who drinks, or vice versa, or the other parent would drink. So it sometimes the children would follow, or there would be an effect on them. Next slide, please. So the cost of alcohol is not only in the price of the alcohol itself. Diba? It has also a cost on rehab. Next slide, please. So let's focus on government facilities na lang, diba? So ang fee is almost 5,000 pesos a month with minimal charge. Then outpatient programs would cost 1,000 to 5,000. Private inpatient rehab would cost 30,000 to 100,000 a month. So it's very expensive. So baka it's time to think na if you drink, your money would be well spent in other things than in having rehab after drinking lots of alcoholic drinks. Next slide, please. So in the Western Pacific region, by 8.3% of the liver cancer, it comes from alcohol, and 60% comes from Hep B and Hep C. But of course, if you have Hep B, if you have viral hepatitis, then you drink. So mas mabilis pa yung pagkasakit. And globally, alcohol is estimated to account for about 19% of all liver cancer deaths, with higher rates in regions in Europe. Next slide, please. So I borrowed this from WHO. So I guess na-mention na rin to kanina. 5 facts about alcohol and cancer. So alcohol does not only affects the liver, it also affects the mouth, the throat, the gullet, the voice box, the colorectum, and also the breast. Next slide, please. And more than 110 cases of cancer in men and almost 70,000 cancer cases in women. So for women, it's mostly breast cancer, and for men, it's colorectal cancer. Next slide, please. So we want to say that there is no safe level of alcohol consumption for cancer. Because in reality, when you drink naman, you don't drink. Katulad sabi ko, di ba? Do you only drink 2 glasses of wine when you drink? Or you drink only 1 bottle of beer or 60 ml of spirits? Which I doubt, di ba? Kasi usually when you drink more than one, even more than 1 hour. And it becomes a habit. And when it becomes a habit, I think that is, kumbaga, mahirap siyang pigilan. Next slide, please. So for those who smoke and then also takes alcohol intake, it's 5 times the risk of developing cancer. For oral cavity or oropharynx, larynx, and esophagus. The next slide, please. Okay, so reducing alcohol consumption will prevent liver cancer also. And of course, there are regulations to make it more prohibitive for people to drink. Next slide, please. So how long can someone live with liver cancer? So on the average, about 21% of people with liver cancer will live only at least 5 years after diagnosis. So if you're in stage 1 or stage 2, there's a 5-year survival rate of 37%. For stage 3, it drops to 13%. For stage 4, it's around 3%. And well, in my interview, when I interviewed those cancer patients, usually they're in stage 3 and stage 4 because usually they're not diagnosed early and there's no symptoms. It's asymptomatic. So when there's already pain, doon pala magpapacheck sila, and then they would find out that they already have a stage 3 liver cancer. Next slide, please. So, the cause of liver cancer is very huge. Yung diagnostic confirmation would cost around 100,000 above. For surgical resection, if you're lucky, then you can have maybe more than 200,000. For local regional treatments, it's more 250 above. And for post-treatment surveillance, it's 200 plus annually. So in a year, that's more than 1 million. But it's not included, I mean, the drugs, because the drugs are not in the PNF. So maybe if you add that, it would cost more than 2 million. So like, for example, when I interviewed a patient yesterday, so he was in immunotherapy, the cost was around 150,000 a month. Ano na yun, with including the GL na yun, guarantee letter. So may guarantee letter na for the government, but still you have to pay out of pocket 150,000 a month. And wala namang ano yun, wala namang number of months. Basta you continually every month take the meds. So it's really very expensive. So sometimes patients would ask me is it really, I mean, logical to continue with the treatment, knowing that, it's very expensive. Some would start with going to private hospital for diagnostics, diba? Pero after, let's say, getting radiation, after a series of treatment, they would opt and go to a government hospital. And syempre, sa government hospital, it's not all complete. So you have to, there's still an out-of-pocket expense, a very huge out-of-pocket expense. Next slide, please. So how to prevent liver cancer caused by alcohol? So I think this is more of a habit talaga. You have to, I mean, the person itself has to have that, what they call, dedication, or what they call that, to talagang he wants to stop drinking. Kasi nasa iyo lang yun. I mean, even if you go to therapy or you get counseling, pero pag hindi ka talaga titigil, hindi ka titigil. Kasi nandyan, the temptation is always there. Diba? So maybe you can start to lessen your drink, avoid binge drinking, get regular checkups. But usually, yung mga liver cancer patients, in general, what they said was that, let's say, for example, for Hep B and Hep C, early 20 years ago, they knew that they already have the problem, but because there's no treatment, so after ilan years, doon pa lang lumabas yung cirrhosis, but it was too late already. Ganun din, sabi nila, sana there would be in the primary care na parang early detection for those alcohol drinkers. Diba? So, everybody was saying na commonly na sana dati ginawa ko na, nagpa-check na ako dati, sana hindi na ako uminom because some would have drank during their teens but after stop but still get, liver cancer when they age. And then two, of course, community and health system intervention, yung alcohol educational campaign. Kasi it's very, I think yung campaign ng alcohol is very strong, di ba? Nagsiseparate sila ng, let's say, drink for boys, drink for girls. They sponsor sports, di ba? Yung mga very interesting things that catches your attention. Kaya nga, dapat siguro yun, medyo pinagbabawal na yun. And then, of course, yun, early alcohol use screening and support for alcohol dependence. Next slide, please. So we can also have policy measures like raising sin taxes, like raise tax for alcohol. Pero sabi ko nga, di ba, you drink, you pay extra, it goes to the sin tax. Then when you get sick, the money for the sin tax is not even enough for you to get treated. And of course, if you're in stage 1, na resection ka, then you're lucky. Diba? But if you're in stage 3, stage 4, diba? Kumbaga bilang na yung ano mo, yung life mo. So, in other countries, they ban alcohol. I don't know, it will happen here. Or restrict alcohol ads. Or enforce public drinking. Baka sa bahay na lang pwede, sa labas hindi na. So it would influence other people as well. And then, of course, label, di ba? Label in alcohol that alcohol causes death. And then, siguro mga simple advocacy message, 1 bottle a day, cancer tomorrow, rethink your drink, or preventing liver cancer starts with reducing alcohol harm. Next slide, please. So screening for liver cancer is one way, di ba? Pero I think it should be integrated in the primary care. So para maiwasan natin, let's say fibroscan, di ba? Or yung screening, yung questionnaire to help identify high-risk individual and encourage them behavior change. I think the more challenging is talaga yung behavior ng tao, di ba? Since it's very hard to encourage. Dapat yung person talaga has a strong will and determination to stop alcohol. Is it possible? Sabi nila, mahirap yan, magkaka-withdrawal. Pero I've seen people na talagang after pag na-opera na, talagang tigil naman. So nagagawa na, even in smoking, ganoon din. Diba? Natitigil naman. Wala naman silang problem. So the goal is to shift community attitude and health behavior. From viewing alcohol as a social norm to recognizing its serious health risks, especially in relation to liver disease and cancer. And yung katulad nila, Philippine Cancer Society, di ba, they have community-based ultrasound screening for cancer. It's a big help. So, it's for LGUs to have that kind of program kasi very devolved na yung health system natin. So it's one way of encouraging them na ito kailangan nyo to reduce, di ba, to have an early detection and para people who know that you have to stop drinking or you have to get treated. And of course, we need increase in PhilHealth coverage for the services that it will provide. So wala na tayong out-of-pocket or lessen the out-of-pocket expense. Government-led integration of alcohol screening in community health programs, yung nga sa LGU, and stronger LGU support and funding because they already have their own fund. And of course, patient advocacy that pushes these services to be accessible and affordable. So investing in screening and education is not just about saving money, it's about saving lives. Next slide, please. Ayun. Yan lang po. Thank you po for listening.
Thank you rin po, Mr. Muñoz. By deepening the discourse on the direct and indirect impacts of alcohol abuse in the Philippines, your presentation po not only highlighted the often catastrophic health and social consequences of alcohol abuse, but it also sheds light on the often overlooked economic and familial repercussions of this pressing issue. That it not just affects individuals on a personal level, but has direct and indirect effects to their families, communities, and society at different levels. Mr. Muñoz's discussion also touches on the important role of civil society groups in advancing campaigns and programs that support health promotion strategies by penetrating through and communicating these to our ultimate and most important end users, which are Filipinos. Now that we've heard our speakers, we will be moving forward to the Q&A section of our webinar. We encourage everyone to join and send in their questions through the chat box of the Zoom room. So for our first question, sige, we'll give ample time for everyone to write down their questions. Okay. Before we start po, we request for our speakers to open our camera for the Q&A portion. And then a reminder for our audience, if you send in your questions, please include kung kanino naka-direct yung particular question so that we can address it to the appropriate speaker. Okay, for the questions po, first question is for Dr. Kua. How can we empower individuals and communities to change their drinking habits given the established evidence of harm?
Okay. So we have to form strategies, as mentioned by Dr. Alendria. It needs a community, a village, to come up with strategies to address these issues here in the Philippines. So in the public health point of view, so first, as I mentioned, so we have to improve our policy measures. We have to increase excise taxes on alcohol to reduce the affordability, and we have to restrict the sales, especially for young individuals less than 21, and also ban alcohol advertising and sponsorship, especially those targeting the youth, no? And raise the legal drinking age to 21. And we have to strengthen enforcement of the drunk driving laws under the Anti-Drunk and Drug Driving Act. And then second, so in the community level, so since we are in the implementation phase of the Universal Health Law, so one of the strategies is to implement the SBIRT in the community. We have to screen our patient, do brief intervention, and refer them to treatment. So we need to train our healthcare workers to deliver these strategies effectively and expand the community screening through the programs. And then third, we also have to expand our treatment centers to overcome barriers like the distance, promote the pharmacotherapy, and also have to integrate the AUD and the ALD care with the MDT teams involving our primary care physicians, our barangay health workers, and our community leaders, and also the addiction specialists and the psychiatrist psychologists. And then most importantly, we have to launch campaigns, no, to reduce the stigma around ALD and AUD, particularly for women. So we have to integrate alcohol risk education in our curriculum sa school and engage our barangay health workers to promote healthier coping mechanism, no? And then we also need to focus on our youth to prevent early drinking, the elderly with the high prevalence of alcohol liver disease, and the post-disaster population. And then most importantly, on the national level, we have to establish a national system to monitor alcohol consumption, the ALD and AUD trends, and evaluate whether our interventions are effective. So we have to remember, we also need to study the local, the cultural, and the socioeconomic factors influence the alcohol use in the Philippines. And most importantly, we have to improve our healthcare access, especially in our rural areas, by using the mobile units, no, and counter the alcohol industry influence to protect the public health policies. So I think these strategies can assess the problems, the unique challenges here in the Philippines, including the cultural alcohol use, our frequent natural disasters, and also our resource limitations.
Thank you po, Doc Ian. Actually, I agree po no, na important talaga or crucial, important talaga yung early detection in providing a baseline data kung how prevalent na this disease is nasa communities, and at the same time to help inform us, not just clinicians, no, but also policymakers on the correct, appropriate interventions. Baka nga kasi hindi lang alam ng communities that there are treatments available or there are programs available that they can avail para rin, for these kinds of diseases. Ayun po. So thank you po, Dr. Kua.
Thank you.
We now go po sa next question directed at Dr. Herdee Luna. So, Doc, when you encounter patients po who are very heavy drinkers, what has been proven in your practice to help them stop? Kasi naiintindihan po natin na when we talk about cessation programs or cessation practices, hindi siya ganun direct agad na na-implement. So, ano po yung in your experience, what has been proven effective in helping patients stop or recover?
Yes, so building a safe circle, no, with your family, monitoring, and also referring them to counselors who can coach them on how to go about their drinking problems. Mainly a personal level of engagement is very successful. And also in the implementation policy side, as mentioned by Dr. Kua, it's very important that from top to bottom, we also have policies ensuring our advocacy, the education, yung restrictions of this. Abroad, parang tinatago yung mga cigarettes and alcohol, pero tayo nakikita pa rin natin in sa stores, sa market. So yeah, it's multi-sectoral effort, but personal, if you need to help someone, make sure that we accompany them in their journey, and also promote a safe environment on when to say no.
Well said po, Dr. Herdee, no? I agree rin na when we look at our patients, we don't just see someone who comes in para to get treated, but rather we encourage everyone to see them as another human being din, na para hindi lang tayo merely magpe-prescribe ng mga treatments, but a holistic approach. And agree with what you said, Doc, na for these efforts to work, it has to be targeted at different sectors and different levels for it to be effective. So thank you po, Doc Luna. Ang next question po is for Sir Chris. Sir, how can patients be connected with PAPO and YWSP if they want to be part of the community so that they can be more aware of events and information such as those given in
Okay,
here.
for PAPO naman, we are continuously inviting those organization that is not still a member of PAPO. So whether you're an SEC registered or non-SEC registered, hospital-based, a small group, that is okay. It's a we can also connect you to national groups, or if you want to be a standalone group, we would help you build yourself. Kasi yun ang ano namin, we're the voice of usually smaller patient organizations. For YWSP, since we are the only national group for viral hep and also for liver cancer, so just get in touch with us through our FB page, the same with the PAPO FB page, or you can contact us. There's a number there so we can respond to your queries, and whenever there's an activity, we'll invite you to be there. Thank you po.
That's good po. That's good to hear, Sir Chris, no? Kasi like what was mentioned by Dr. Ian and Dr. Herdee, sometimes nga baka lang kulang lang tayo sa information dissemination, and it's are also
Recording in progress.
I think Dr. Herdee Luna is experiencing connection problems. So we'll park the question first and we'll proceed with the next question po from our audience. So while waiting po, this question is direct. Doc, during the confinement of patients with stage 4 liver cancer, is it still advisable po to give life-saving medicines to such cases? Or should the doctor opt to be more open sa family, sa mga kamag-anak, that whatever medicines will be given will no longer take effect on the status of the
Yeah,
patient?
so that's a very important question, no? So uh, once the patient, how to deal patients with stage 4, so we have to inform the patient and the family. Now this is the stage of the disease, the prognosis, and usually an option sa stage 4 liver cancer is immunotherapy. And then, so we also tell them the prognosis is not good because it's stage 4. And we'll also give them the chance or the opportunity kung gusto pa nila mag-treat. But on the other hand, we also need to emphasize that we also discuss about palliative care. So making sure pain-free yung patient, and then okay yung nutritional status, there's no infection, and then talk to them. We have to lay down the cards. So these are the options left for you. And then if you're willing to treat, so these are the prognosis. So we have to be very upfront with the patient.
Thank you po, Doc Ian. No? Actually, as practitioners, clinicians, it comes with our profession or with the job, na yung breaking the the bad news to the patient and to the families. But siguro para rin emotionally, makapag-help prepare na rin yung, and mentally yung patient and the families. I agree, Doc, that it has it is our duty to be upfront and be transparent with the patient. No? Thank you po, Doc. Actually, another follow-up question for you, po, Doc Hua. Is it possible po ba to have liver damage? And I think ito talaga yung burning question that everyone wants to to find out. Is it possible to have liver damage even in occasional alcohol intake, like kunyari mga celebrations or mga holidays, ganyan, New Year, Christmas, or is there a limit of alcohol percentage to drink to avoid it? I think na-emphasize siya, Doc, in one of your slides
Yes.
eh.
So that's
Mm-mm.
very interesting, no? Kasi syempre alcohol is parang na-embed na yung sa ating culture, di ba? So I think as long as the patient doesn't have any chronic liver disease, so you just can take 1 to 2 drinks, but occasionally, not binge drinking, not every day. I think that's the safe intake that alcohol intake that we can, like 1 to 2 drinks of alcohol. As I mentioned, because fatty liver, patients with metabolic syndrome, diabetes, obesity is so common nowadays. Diba halos 60% ng population natin may metabolic syndrome. So as I mentioned, we have to limit the alcohol intake in this particular subset of patient, maybe 1 to 2. So because studies have shown that this patient may have liver damage even though they don't have any symptoms, they don't feel anything.
Thank you po, Doc Ian, no? Actually, emphasize rin natin yung social role ng peer pressure eh. Sometimes hindi mo talaga maiwasan na to have more than the prescribed number of glasses, kahit pa sabihin natin 1 to 2, parang minsan ma-influence ka talaga by the environment, by your peers, 'di ba? So ang hirap din. But
Importante
yes,
kasi we have to do more public awareness that alcohol
yes.
can do more harm to the liver and also to the well-being ng lahat.
Agree po, Doc. To everyone po, we're down to the last question. But if you still have, follow-up questions or to keep the conversation going, just type in for your questions and we'll try to address them. But for the last question po, this is for Sir Chris po. Sir Chris, what is your opinion po of our government? What is your opinion po if our government directs the total ban on liquor products?
Well, well, I think it's up to the state, di ba? How to talaga control. Parang if katulad ka ng Singapore, di ba? Bawal chewing gum lang, di ba? Pero they can enforce it. So it depends on the state talaga, di ba? If they see na is it enough na parang taasan mo yung presyo para magkaroon ng sin tax, then you use your sin tax to treat patients, or baka mas mabuti na i-ban mo na lang para wala ka ng sakit ng ulo kasi like earlier, di ba, we tackled na the effect is not only on the person itself, it's also on the family, it's also on the friends, di ba, yung mga road accidents, di ba, one drink lang, one night drink, di ba, tomorrow may problema ka na. So if you sum it up, all of those effects, baka it might be reasonable to ban alcohol in the Philippines. Yan lang, but back to you.
Okay, thank you po, Sir Chris. Yeah, I agree nga po no na maybe important talaga yung role ng sa health policy and systems researches, no, so to provide or to produce evidences on this na so that our government will be guided on how we can better address these problems. Ang hirap din kasi na, para guided din yung mga policies na. Thank you po, Sir Chris. To our speakers po, thank you for answering our questions. To Dr. Kua, Dr. Luna, and to Sir Chris. It was a great Q&A session, and ako personally, I learned many new insights, and I'm sure that our participants felt the same way. So with that, we have a recorded message from Dr. Stephanie Adco, HPP's very program manager, to close our event today.
Good afternoon, everyone. On behalf of the Health Promotion Program, thank you very much for joining us in today's important conversation. This episode of Unbottling the Truth continues our year-long campaign to raise awareness about the wide-ranging harms of alcohol. Through this series, we've aimed to spark conversations, share evidence, and advocate for solutions, and we're grateful that you've been a part of it. We are deeply grateful to all our speakers this afternoon. Dr. Ian Homer Kua for grounding us in the science of alcohol-related liver disease and its clinical management. Dr. Herdee Glorianne for emphasizing how cutting alcohol is not only beneficial to our health, but also to our finances, and for sharing practical treatment and funding pathways. And Mr. Christian Muñoz for sharing powerful lived experiences that remind us of the very real human toll of alcohol-related illness. Today's session reinforced a clear and urgent message that no amount of alcohol is safe. While this session focused on liver disease, we know that alcohol affects health on many levels, physically, mentally, socially, and economically. We've also heard that alcohol's cost goes far beyond the bottle. Treatment, hospitalization, rehabilitation are expensive, and these burdens often fall hardest on families already under strain. This is why prevention matters and why our roles as health professionals, advocates, and engaged citizens are so important. This topic is also deeply personal to me. My own father passed away from liver cancer related to alcohol and hepatitis. Some time has passed, but the experience continues to shape how I approach this work. It is a quiet and constant reminder that alcohol-related harms are not just clinical or policy issues, but they are deeply human ones. As we move forward, I hope today's session sparks even more conversations in hospitals, classrooms, homes, and policy tables. Let us continue working together to spread awareness, promote prevention, and push for a culture where alcohol is no longer normalized and its risks are no longer minimized. Because at the end of the day, we must remember no amount of alcohol is safe, and every step we take towards reducing harm can save lives. Thank you once again for being with us today, and we look forward to continuing this advocacy with all of you. Thank you very much.
Thank you, Doc Steph. So that was a very strong message and a very personal and heartfelt one. No? Her message highlights how alcohol consumption significantly affects everyone. So thank you again, Doc Steph. Now, before we close the curtains, we invite everyone to answer our events evaluation form as flashed on the screen. It can be accessed through the QR code shown and through the link messaged by the organizers on the chat box. So your responses will help us plan future events of the UP Manila NIH Health Promotion Program. You may answer the evaluation form by 5 p.m. today, but please be guided that answering this is also a prerequisite to receiving your certificate and that you are requested to answer the survey using the email address that you used to register for the event. As we screen and validate the responses, we appreciate your patience in receiving the certificates. So rest assured na as long as you registered, you attended via Zoom and answered the evaluation form as instructed, you will be receiving your certificate through your registered email address. So that concludes our event for today. To stay updated on the latest happenings of the health promotion program, feel free to follow our social media pages shown on the screen and sign up to our newsletter by scanning the QR code. So we hope to see you po in our future events. Thank you. So to our participants still on the call, thank you again for your participation. We will now be closing the meeting room. If you need access po to the evaluation form and the link, you may find it in our YouTube live streams recording. Also, you may opt to message us via HPP's Facebook page. And once again, thank you po and have a nice day.
Recording stopped.